Hello everyone, welcome to my channel CAPSA. Today we will learn about statins or HMG OA reductase inhibitors. What is statins? They are most effective agents for treating hyperlipidemia and also known as lipid lowering drugs. So, most effective agents for treating hypercholesterolemia, lipidemia, and also hypercholesterolemia. That's why they are known as lipid lowering drug. Okay. Now, what are the examples? So, what are the examples? These are atorvastatin, rosuvastatin, pravastatin, pitavastatin, lovastatin, simavastatin, etc. Okay. Now, all of these drugs have shorter half-life. Only atorvastatin and rosuvastatin have longer half-life. And lovastatin, simavastatin are the prodrugs. Which gets activated in the liver in their active form. Okay, this shows extensively fast pass metabolism and excreted in bile. Now, what is the mechanism of action? HMG-CoA reductase inhibitors actually competitively inhibit the HMG-CoA reductase enzyme, which is responsible for the conversion of HMG-CoA to mevalonate. So, HMG-CoA to mevalonate then forms cholesterol. Okay, and this step is blocked by HMG-CoA reductase enzyme inhibitors. Okay, this enzyme is responsible for HMG-CoA to mevalonate conversion. Then further conversion forms cholesterol. If this pathway gets blocked, so obviously cholesterol will not be formed. So cholesterol biosynthesis stops. Now this is the mainly rate limiting step. And after the inhibition of cholesterol biosynthesis, what happens? Decreases in the blood low density lipoprotein and also very low density lipoprotein levels As a result, decrease in the cholesterol synthesis. If there is decrease in the cholesterol synthesis, obviously increase in the low density lipoprotein receptors or their availability of this kind of receptors in the liver will increase. As a result, increase in the uptake and degradation of low density lipoprotein occurs. And side by side, they also decreases the triglyceride levels and also decreases high density lipoprotein levels in plasma. Okay, and they actually given in the evening. Why they are given in the evening? Because maximum cholesterol biosynthesis occurs mainly in the night. Now, what are the adverse effects? So, adverse effects are hepatotoxicity, headache, myopathy, sleep disturbances, anorexia, nausea, vomiting, etc. And it is contraindicated in pregnancy. Okay, now what are the drug interactions? It actually interacts with cyclosporine and erythromycin. These are the drug interactions. Now, what are the indications? Or the clinical use are familial and non-familial hypercholesterolemia, prevention of cardiovascular disease, in the treatment of hyperlipidemia, dyslipidemia, etc. So this is the end of my lecture. If you like my video, please do comment, like and subscribe. Thank you for watching.